Hello again. Great to be with you. I've got two reasons why I think it's great to be with you so far today. One is that I drove over from West Oxfordshire, and as time went on, the sun came out and it got better and better the nearer I got to here. The other thing is that it's a chance for me to learn about what's going on in Wales, because I'll tell you now, I don't know a lot about what's going on in Wales. So those are two reasons so far. I also think it's a great time to be talking about arts and health. From where I sit, it's a time of new energy, new creativity, and new determination. I'm going to be talking mainly about arts, the role of the arts in improving health. But before focusing in on that, I thought I should just mention a few things to remind you that arts and health, the relationship, is much richer than that. So I'm going to tell you about Barbara Hepworth and Norman Caitner, about Bobby Baker's diary drawings, and the National Institute for Dance, Medicine and Science. So Barbara Hepworth got to know this surgeon called Norman Caitner, and he invited her to draw sitting inside the operating theatre. And this is one of many hospital drawings that she made. I think they're utterly beautiful. Hepworth Gallery ran an exhibition of the hospital drawings, so if you want to have a look at this later, you're very welcome to. What I love about this is that she was inspired by Norman Caitner's work, but then she invited Norman Caitner to her artist studio. He looked at some of the sculptural tools and said, I think I'll have one of those in my operating theatre. And so, two-way traffic, and they're referred to as Caitner tools. The second one, you may know Bobby Baker, performance artist. Bobby had a long period of mental illness, and in order to cope with this, she did what she called diary drawings. The middle one is right in the middle of her thing, and it says, Yoga for Weepers. The final one, and it says 711, she did 711 of these drawings, and it says, the diary stream of consciousness, and it looks as though she's managed to find some kind of harmony. And the last one is an organisation that is fairly young, but is all about the health of dancers. So in other words, just running through those again, that arts and health can be about health as an inspiration for art and arts as an inspiration for health. It can be about art expressing the experience of illness and commenting on, and if you look at some of the drawings, kind of critiquing. Bobby is not uncritical of the treatment that she received. And lastly, yes, there's the whole issue of health of artists. But I'm going to zoom in now and talk about arts contributions to health improvement. There's this poster, you won't be able to read it, but I've given you the link for it if you want to look it up. And the heading is there. I think it's a pretty good list of the contributions that the arts can make to health. That is to the healthcare environment, to psychotherapy, particularly arts therapies, technology, participatory arts, staff, and everyday life. I think there are a couple missing. One is the whole thing. It's not just staff, it's actually the health system. This comes from this book, which I've also published this year. Fantastic, rather large, heavy tome, but it's the most wonderful textbook on creative arts, health and well-being. One of the articles in there is by two public health professionals who say, if we are to create widespread change in the health system, we will need new art, stories, myths, symbols, and much else to help us make the inner and outer transformations that will be needed. So I think there's something about the health system as well as staff. And I think the other one, a bit of an omission, is public health education. I'm going to talk about Maslar in a moment, but recently I met a dean of one of the faculties at University College London, and he is about population health. And when he was telling me about his work about HIV in Africa, and so I said to him, how do you get people to understand health messages in Africa when I guess a leaflet is not actually going to do the trick? And he said, we send out drama touring groups. That's the way we communicate. But he hadn't really thought that was arts and health. he just thought, yeah, that's the way we're going to do it. I thought then I'd give you a kind of flavour. One or two people say I'm here to just kind of get an idea of what's going on. So the event that was referred to was a showcase of 24 arts and health programmes in England, selected with the help of the NHS Alliance. The first one, the Reader Organisation. I hope this is where, look, just stay there, see if I can do it. So the Reader Organisation is all about small groups reading aloud and together novels, poems and short stories. And this is Louise. She had great guts. She was standing up in front of 450 people telling her story of mental health and mental illness. So this is one. Here we go. I'm just giving you a 1 minute clip.
Might need to turn the volume up, I'm not sure.
I used to read alone. I used to ring up the hospital maybe once or twice a week with a knife or matches in my hand because suffering from post-traumatic stress, my life was at times totally unbearable. At times before meeting the reader, I would spend maybe 2 weeks of every month in a hospital bed. The hospital ward was my home because the diabetes was completely out of control. I read with another group, I read with other people. Today, if you asked me to ring up the hospital, I would not know the number. If today I come away on holiday with I've never leave the house before, and today the Reader Organisation is my home, not a hospital ward or a hospital bed, because they've turned my life, which was totally unbearable, into something which is totally unbelievable.
The second one is Raw Sounds. Now, Radio 4 came along to the 5th of Feb, and they made a news item that was on the PM programme. And the beginning of it is all about raw sounds. Help now. I found it. There it is.
It's a summer day. I look out my window and say, I love this kind of weather because it uplifts me.
This is rapping on the NHS.
I see your fear and shoulder pressure in the door.
Malik Bennett from South London was sectioned in 2013 with severe mental illness. When he came out of hospital, he got involved with the Raw Sounds music project in Brixton. It changed his life.
It's in a merry kind of mood. I was doing singing with a live band, and then it's developed by doing DJing, production, going in the studios, recording tracks. Yeah, so I kind of take part in a bit of everything.
Raw Sounds works in the most challenging hospital environments.
So Dr. David O'Flynn, I'm a consultant rehabilitation psychiatrist and work at Llandridnod Hospital where Manic was trained. And they've all had pretty awful inner city lives with the violence and drug use clearly related to the upbringing, educational failure, state life and the environment.
Dr. O'Flynn says Raw Sounds reaches the person rather than the illness, offering something that's relevant to their lives.
Doing art provision is relatively low cost compared to other things. And it gets people out of my very expensive beds much quicker. I think it's about reducing length of stay. My beds are £500 a night. It doesn't take many shortened admissions to pay for Raw Sound.
And the last participatory one is one that we've created. It's called Dance to Health, and it responds to a real problem in the NHS. So NHS England, the cost of falls, older people's falls, is £2.3 billion a year. 25% of all ambulance call-outs are because of older people falling over. And then unfortunately, the way the health system has responded is to create really boring physical exercise programmes. I met the clinical falls lead at the Royal College of Physicians, and she said they're dull as ditch water. So this is our attempt to come up with something which is a bit more engaging. dance to health, for the older person, it's fun, it's sociable, it's creative, and it massively reduces the chance of you having a nasty fall.
It is getting you moving. Plus the fact that you're meeting other people as well, because often elderly people are on their own. So it's a good combination. You're actually meeting people, social side, but also improving your fitness.
And the last clip I wanted to play you, it comes back to the thing that I was saying about public health education. So Maslar makes films, and it's particularly about a film for doctors and Somali Muslim communities to help them get mental health support. It's in Somali, by the way. Hope you can read the subtitles. Oops, I didn't mean to do that.
xanuunada nafta iyo casaabta ku dhaca way fara badan yihiin. Labada ugu waaweyn ee dadka intooda badan ay maraan waxa la yiraahdaa depression iyo anxiety. Xaaladaha lagu garto waxa kamid ah adiga oo warwar siyaada ah haysta, adiga oo cara badan haysta, adiga oo nacaw wixii aad jeclayd inaad qabato, adiga oo dadka ku deeqadooda oo doonayn in cid kula hadasho, adiga oo wixii noloshaada ay maalin walba ahayd qabsan kari waaye. Haddaad isku aragto xaaladaha la xiriir dhakhtarkaaga ayagaa ku diraya meelaha lagugu caawiyo.
Waxaan ku bilaabaynaa horta caafimaadka jasadka iyo caqliga ama dhimrigaba waa waxyaabaha Ilaahay subxaanahu wa tacaala nagu galadaystay nimcooyinka faraha badan ee Ilaahayna siiyo kuwa ugu muhiimsan. bini'aadamku waa xanuunsadaa, markii la xanuunsadana macnaheedu ma Ilaahay aan tala saarnay, Ilaahay aan baryo.
So I think you can understand why I'm excited. I think this is a very exciting time, and with programs like that it's very encouraging. So I do think we need to be honest though about some of the problems that we face. Someone mentioned Peter Senior. So Peter set up the Manchester Hospital Arts Project in the mid-70s. So this sort of work that we would know of as Arts and Health has been around for 40 years. But it's been 40 years of trying to get it into the health mainstream and it still hasn't happened yet. If you do talk to health professionals, I talk to a lot of health professionals, unless they're arts enthusiasts, and they're great, they generally take the arts as fluff. Nice to have, nothing to do with the day job, totally incapable of delivering a serious, robust health outcome. Then there's also this reticence still within the arts. I think it's changing, but the idea of just simply thinking of the arts as a tool to achieve a non-arts outcome, and not really respecting the artistic practice. So there's reticence there. We've done some work trying to estimate how much of the NHS England budget is spent on the arts. This is excluding arts therapies, that established area of work. And we think it's certainly less than 0.007%. Let's be honest, the evidence base is still weak and poorly disseminated. This is from the point of view of the health service. It does not score particularly well, although I'm glad to say it's improving. I met someone, senior manager at Public Health England earlier this year, and his view is that the arts relationship with health is 10 years behind sport. And nothing has gone to scale. In other words, if a health intervention of some kind is really effective, the whole idea is it should be disseminated throughout the NHS so that all patients are able to benefit. Nothing, apart from the arts therapies area, has gone to scale in the NHS. So having depressed you, I'm going to give you some good news. We are very fortunate in the UK. We have a world-class arts scene, and that is a great resource for health. Gareth mentioned from, what's your organisation? Voluntary Arts? Voluntary Arts Wales. So the voluntary sector, this is in the UK. You've got 49,000 arts groups and 9.4 million people participating. Health talks quite a lot these days about social movements. This is a social movement and a very relevant one. We've also got the publicly funded sector, but we've also got the commercial sector. We're blessed. And there are success stories. I mentioned, you saw the reader in terms, and listened to Louise, but from a business point of view, I think they're the leader in terms of arts and health. They've got to the point where they're receiving £2 million of commissioned income a year. They started in Liverpool 10 years ago. They're now well spread out across England. They also have a presence in Wales. So they're growing. And we thought we'd bring together arts organisations in England which are already commissioned by Health and Social Care. And we've got 22 members. We meet 3 times a year, action learning set, learning from each other, visitors teaching us, learning from them. So there's a nice critical mass there. And then research and policy work. We worked with the University of Winchester and managed to get commissioned by Public Health England to create the first arts and health evaluation framework, coming back to the lack of evidence. And yeah, it's on the gov.uk site, and you can download it from there. There is now a Royal Society for Public Health, Arts, Health and Wellbeing Special Interest Group. Mention has already been made about the all-party parliamentary group for arts and health and wellbeing. They have an inquiry going on at the moment. They're learning lots and thinking about what policy recommendations could we make for the future. And they're reporting in 2017. We also realised, in fact this was some time ago, that if you're going to get arts interventions or arts programmes into health and bought by health, they've got to be cost effective. That leads you into the weird and wonderful world of health economics. So we were the first people ever to bring arts and health economics together, and we've got some good alliances going there. And then there's the thing of raising the profile of the arts in the health sector. Been this thing called the Cultural Commissioning Programme in England. It was a £1 million contract from Arts Council England to encourage public sector commissioners to commission the arts. So it's partly attitude change, but also just then giving people the experience of working with arts organisations. There've been quite a lot of health commissioned, activity. My favourite one was waste management. Kent Waste Management commissioned an arts organisation. Wonderful. And then we've touched on this, the first national arts and health event for health decision makers. And as a legacy of that, we've created what we ended up calling the online dating site. If you go and have a look at this, Aesop Marketplace, it's got all the 24 arts programmes that were featured on the 5th of Feb, and we're working really hard to get health commissioners to use it. So it's a quick way of getting a flavour of what's going on in arts and health in England. Yeah, it comes back to this thing, you have to work really hard to engage the health sector, but we're getting somewhere on that. We've been asking ourselves, what are the ingredients for success in this area of arts for health improvement? And we've ended up thinking, really, you've got to look at it like with different pairs of glasses, different lenses. The first one is, I think it's got to work as artistic practice. So you look at an arts and health programme through an arts lens, and we wondered about what would be the best way to do this. I'm not sure what's happened in Wales, but there's been this programme you may know of called the Manchester Metrics Pilot, which was looking at how can we measure quality, artistic quality. And I'll whiz them through for you. Quality of product, experience, quality and depth of engagement, quality of the creative process, leadership, relationships and partnerships, and financial metrics as well. So that, if you look at an arts and health programme from an arts perspective, those might be the things that you should think about. And we've also asked ourselves, well, okay, if we put our health glasses on, what might we be talking about? And what we're really talking about, certainly with Aesop, and like the reader example I gave a moment ago, is that we're trying to get to a position where health so values arts interventions, they pay for them. You don't have to fundraise anymore, you sell them into the system. And so commissionable programs need to be responsive to health needs. So we got very excited when we found out that older people's falls cost 2.3 billion. If we can start bringing that cost down a bit, then people would want us to do that work. They've got to be effective, obviously. Back to health economics, they've got to be cost effective. They've got to be sustainable. Health people do not wish to work with an arts organisation which then goes belly up 12 months later. They want to think, yep, we've got a relationship with an organisation that is here for the long term. Yes, it needs to be evidence-based from a health point of view. It needs to be of consistent quality. So you might have a project which worked really well in one part of Wales, but actually you haven't got the artists in another part of Wales in order to be able to deliver it. And therefore, if patients want it, you're not in a position to deliver. You need that consistent quality. And finally, capable of going to scale, so that all patients can actually benefit from what you have to offer. So the last thing really is, and it's the question that's already come up, what next? What ideas do we have about what could be done to move forward this important movement? These are the things that we're trying to do, just that. First of all, anyone who's set up a website will know that you can't just set up a website and leave it there. You have to be very active to make sure that you get traffic to that site. And so we have someone working a day a week on exactly that, using social media, marketing, our networks in health, all sorts of things. Then, training, professional development has been mentioned already this morning. What depresses me about a lot of CPD in the arts is that it's funded for a while, no one ever thinks about what the sustainable financial model is, and it all just stops. We're determined to create CPD for arts people and health people about how they can collaborate effectively, how they can communicate, understand each other's worlds. Enormous amount of work to be done in that area. We are about to sign a memorandum of understanding with Canterbury Christ Church University on this. It's where, I don't know if you know, the Sidney Dehaan Research Centre for Arts and Health, an important research centre, one of the leaders. So we're trying we'll need start-up funding for it, but the idea is we get it to a point where it works as a social enterprise. And the last one may not be that familiar. Who knows about venture philanthropy? Hands up. No. Oh, one. Bravo. So it's not easy creating an arts program, an arts and health program. It's not easy to get it to go to scale. All sorts of tricky things along the way. And venture philanthropy developed in the States and then has been growing in a kind of different way in Europe. And in my previous job, I was very involved. It was called the European Venture Philanthropy Association. And it's a way of helping charities, including arts organisations, go to scale. And it's very different from the model of you apply for a grant, you get a grant, you do the work and you report. It's a much closer relationship. It's got 6 elements which I will whiz through. First one is, yes, a very high level of engagement. The venture philanthropy organisation sitting alongside the arts and health organisation. The focus is on the organisation and not individual projects. There's a strong emphasis on performance measurement, so you have an idea of the progress that you're making. It's multi-year support. It's not one-off grant. It tends to be 3 to 5 years. And tailored financing. So, yes, there will need to be, or put it this way, suppose you had an arts and health organisation which was starting up. It would need grants, I'm absolutely clear about that. But it could get to the point where it's receiving commissions from the health system and it doesn't need any grants anymore. And so you need grants, but maybe later on you might manage on social investment, in other words, recyclable money. Ask me about all of this later if you want, but recyclable funds rather than grants which are not handed back. And lastly, non-financial support. Think of consultancy, people coming alongside you, challenging you, injecting you new ideas. I think it's a very... I've been really impressed by venture philanthropy, and I think if there is that chance of getting to a point where you are reliant only on earned income, venture philanthropy is really important. I've sold the idea initially to the Arts Council of England, Department of Health, Strategy Unit, and Public Health England. Still at a very early stage, but I think it could be rather an important contribution. Thank you very much.